So feedback meetings are very, very important. So whenever there are meetings are means organized, you must join them. Uh, why it is important? Because you will learn from others' mistake. What were the questions, typical questions examiner asked, and what are the mistakes candidates have done. So feedback meetings, and you should note down what were the mistakes by others. Second, mock exams are again important. Though I know this is very costly because many people are who are conducting mock exams, they're costly, but at least two mock exams must be there, is you should attend. One should be 2 months before the exam, and second should be 1 month before the exam. So what will happen? You will prepare two times, just like exam. Hmm. So if you prepare two times, just like exam, and then again you will prepare for the real exam. So three times you will prepare yourself. So chances of mistakes will be very less, errors will be very less. So that is very important. And anyone from Pakistan in this meeting? Dr. Nabila. Okay. Yes, Dr. Ma. Can you please call Dr. Ahmad on his number? I give you the number, his number. 1 second. I will give you his number. Yeah. So out of 10 stations, when I entered, before starting my exam, it was in Hyderabad this January. Before starting the exam, everybody has anxiety, right? So, though it was very less with me, and at night I could sleep only 3, 4 hours. Morning at around 5 o'clock or 4 o'clock, I got up because there was some sound near the hotel, and because some disturbance, I got up and then I could not sleep. So, just passing time. I didn't read anything in the morning. I had to spend 2 hours in the morning in the room. Then I had breakfast, so fruits I could take, nothing else. I like fruits only when I'm in stress or like this. Then I took bath and went for the exam. Exam hall was, I think, hospital was almost half 500 meters from my uh, this hotel. The main issues were there that these exams are start in the morning. If you are a AM, then you have to reach there by 8 o'clock. And 8 o'clock, if you have to reach, means you have to get up around 7 o'clock. That is very, very difficult because you are in sleep and you are not able to. If you don't sleep for 7 8 hours, it's difficult for you to concentrate in the exam. But still, I managed to reach exam hall by 8 o'clock, and then all the students were gathered in one room. I could see many senior people to me and very junior students were there. And the chief examiner came, he briefed everything. So at around they brought some breakfast for us, tea. So I tell you very interesting thing. One candidate, lady who was sitting next to me, and nobody was taking breakfast. I mean sandwiches and some other things were there. But that lady was very much interested in taking breakfast nicely. So I was so amazed. Oh my God, this is a good candidate. She is without stress and she is taking breakfast nicely. So I was very happy to see her. But I took tea or coffee, what I don't remember. Then it was around 8:40 or something. I took one propanolol tablet that was in 10 or 20 mg because that will reduce your heartbeat and stress. So that I remember first time I took this tablet in exam. Okay, and at night also I had taken one tablet. I don't know alprazolam or something, point 0.2, maybe minimum dose at night so that I can sleep. But ideally, it is not advised. But first time I tried that because one of my friend told me that he had taken in the exam and there was no drowsiness something. So I tried. But yes, propanolol is not a bad medicine. So it depends. But if you have asthma or glaucoma, then don't take it. Very dangerous. So 20 mg is quite good. That is my personal opinion. It is not for everyone. If you take, then you should take at your own risk. Don't say that Dr. Bora suggested, so we have taken. It is up to your choice. Mm. Then once exam started at 9 o'clock, I was the second candidate that day, I think. So we started with the clinical station. So one girl, I think, who was from Kolkata. There is a pair, means two students will be in pair. So me and that girl, I don't remember her name, were in pair, and we started with clinical station. So she entered in one room, another room. Next room was for me, and I was sitting there outside. So they give the uh, a outside clinical station. They don't give nowadays. They don't give anything. So you have to sit idle only, and you will not know that this is which station, right? This is cardiac or this is CNS, whatever. So that is not disclosed. So when you enter, you greet the examiner, and then introduction, greeting, repo, permission from the child or the parents, both. So, so you have to take. And first case most probably was for me was I think thalassemia. I don't remember exactly which was the first case, but yes, thalassemia was one of the case. So I had to check GA station. So after introduction, greeting, repo, permission, I had seen the surroundings and then did my general physical exam and then specific like inspection, palpation, percussion for the abdomen, chest and abdomen. Then that thalassemia is very very common. So two things are very common, GIS in thalassemia, and another is portal hypertension. But portal hypertension they usually ask in online exams. Mm. Uh, so thalassemia or some other candidates can get hereditary spherocytosis, but findings will be very minimal. Only splenomegaly will be there, or mild jaundice may be there. Usually we see that HS is seen in Caucasians, right? So British white, but you can find this in Asia also. It is not very rare. So be careful about that. But most of the cases in GI is either thalassemia or uh, this portal hypertension. But usually see portal hypertension children are cachexic and they're not comfortable. Hmm? Yeah, 1 second, let me put in the group. 1 second. Thalassemia, they ask you very typical questions. Uh, First they see how you are doing. If you are haphazard, like if you do inspection, palpation in a then percussion in a systematic way, then only they will get marks. If you do like first inspection and then you did percussion and then palpation here and there, you are going here and there, and then they will not give the marks, right? Or they will deduct your marks. So be careful about that, like superficial palpation, deep palpation. And then lower limb is very important. Back is again important. So you need to be very careful in GI. So I got full marks in that station. And whatever he asked me, so they usually ask the same questions which are repeated all the time. So you should prepare these two cases very nicely. Thalassemia and this one, portal hypertension. Then next station was CVS. So I came out and then I was sitting. So I was trying to find out which case is this. In this, they had kept that measuring tape also. If you want to check the liver span, or so you need to check in the surrounding. Is there anything that they kept there or not? So examiner was good. Overall, what I have observed that in India examiners are very good. Mm. They are not so means what we call very cooperative. I am so happy with the examiners in India. Their second session was cardiovascular. Yes, yes. You want to ask anything? Okay. Next was CVS, and that was post-operated case. So there was a clear-cut scar mark. But see, that was 9 or 10 years old girl. I think she was 10 years, and see that it is very difficult for a male candidate to check the female candidate, right? So she has breast development and she was covered with the chest, means it was usually you see in the exam they are exposed, but she was covered in her, she was wearing the shirt, and father was there. So I just took permission from the examiner. I just told examiner that I would like to expose her. So then father immediately told me, yes, yes, I will help you. Then father came and he just pulled up the shirt. So it was up to uh, you can say fifth or sixth rib. He didn't expose full, so half. So it was I was very hesitant because I need to see the full scar, and then I need to auscultate also. So I would like to auscultate her with without clothes or without dress, so bare chest. So I just pulled up little bit, but I told the examiner, and he said yes, you can do it, but be modest. I said yes, sir. I definitely I will. So I was very hesitant to check that girl, but I was doing in the sequence like inspection, whatever percussion, and then auscultation. So I did front, and then I could hear there is a murmur in the left second intercostal space, ejection systolic murmur, and then immediately after that I checked liver, and then I asked her to sit. So before going to the back, I checked lower limb, meaning edema, clubbing. There was a clubbing actually and mild cyanosis. Then on the back, I had put my stethoscope inspection and then stethoscope auscultation. So I could hear murmur, radiating murmur very nicely. So I understood this is a most probably operated case of TOF because she had cyanosis, pale. Hmm. So after all this, I presented my case to the examiner and he asked me the question why it is tetralogy of Fallot. I said this is the region's central scar. This is clean scar. And then there was one right lateral thoracotomy scar was right lateral thoracotomy scar was also there. So for that, I need to pull the shirt up very up, up to the axilla. That was very difficult for me for an adolescent girl. Uh, because sometimes you are doing good things and the examiner will be frustrated, will be angry. So you don't know. Then he asked me other question, differential diagnosis, blah blah. So I answered everything and then I came out. I got 7 out of 8 in that station. So examiner had given me the comment that you were very hesitant in examination. So now it is not in your hand. So what I understand that I was not hesitant at all, but because this was an adolescent girl and her chest was too much. I mean, age compared to the age, no. So I think just like precocious puberty, its breast development was too much developed. So very difficult, and that's why I was hesitant. But he deducted my 1 mark. So it's okay. It is your luck, right? Uh, so these were two cases. Then third case. Uh, yes, short stature. Then I enter in the next station, and you don't have time. See, remember, you don't have time to think in the exam. Whatever question they ask, your answer should be immediately within 0.1 second. You have to start your answer. It is not like they will think you are thinking, and then another thing is you cannot do like pauses. You cannot take pauses. Fluent answer immediately you have to answer. That's why practice is very important. Why everyone says practice. This is the importance of practice. You have to answer immediately. Nobody will wait for you because they have 3 minutes, and within 3 minutes you have to summarize to tell to the examiner, and then differential diagnosis, investigations, and treatment. Everything they will ask you. Uh, so next decision was when I entered, I could see that it is that examiner told me she is he or she is 9 years old, and he was very small, like 3 4 years old. So I did a full examination, like short stature, general physical examination. Then I told the examiner I would like to check his sitting height and this standing height, sitting height. She gave me this, and after this examination, general, then I did systemic also. Like I checked his abdomen. Abdomen was little mild distension was there. I checked his buttocks also for celiac disease, but there was no pallor, and buttocks were not vested, and abdominal distension was there, but there was no like portal hypertension, capillary nothing. I was thinking heart. I checked. There was nothing in the heart. So only findings of abdominal distension. That was the and short stature. These two things, and he was proportional choice. Don't not dysmorphic position, nothing. Then she said, "Okay, these are the growth charts. Can you plot on this?" So yes, I said. I showed the examiner. She was a lady. This is percent. How to take percent. So in the growth chart, downwards there is a weight centile, and upwards is height centile. So I told her that this he is 9 years, so I will do like this. This is 9 at the x-axis. Y-axis I showed her that this is height, and then this is going on this centile. So it was, I think that was he was on 0.4 centile or something. Then I said, I will take the parent side, father, mother, then mid-parental centers I will take out, and if it is two central above and below, then I have to investigate the child, and before that I will take the detailed history, birth history and all. So she said, okay, what is your differential diagnosis? I said that this child is professional short stature, and this can be, I said this is maybe uh, inflammatory bowel disease, but baby doesn't, she or he doesn't have pallor or no other signs, mouth ulcers, nothing. I said I would like to check his back passage also for the fissures and all. Second diagnosis may be celiac disease, but there is no wasting and no pallor in this child. I justified why I'm what I'm thinking. Then I said it may be uh, chronic renal failure, but so because there is a abdominal distension, but for that I need to uh, I didn't find anything, any other, I mean, edema or nothing is there in the legs. And what I answered for CKD, but I just gave three differential diagnosis, but I didn't give, this was the SGA baby, small for gestational age. Okay, so when in the evening or next day, people, candidates were saying this was SGA baby, because to one candidate, the doctor examiner told him or her that this is SGA baby. So that's why I came to know later. But I gave my three differential diagnoses which were not fitting in that child, but I gave the explanation why I am thinking like this. So she was happy. And the growth charts, you should be very fluent in reading growth charts, and she could understand that I am very fluent. I showed her. It took only 30 to 40 seconds to me to show the growth charts and mid-parental centiles and how we'll compare, blah blah blah. So she gave me full marks in that short stature. So that was good. So it doesn't mean that if you don't give that correct diagnosis, then you will not get full marks. It is not there. Then fourth station, when I entered, I thought that this is CNS definitely, because CNS and GI, they fix you will get. Yeah, one may be others and one may be respiratory. This one CVS, GI and CNS are for sure for you will get. And one others, sometimes you get short stature, neurofibromatosis, tuberous sclerosis, blah blah. So fourth station was I entered, in that lady was there examiner, and one child, I think he was a boy, and he was sitting on the chair or couch. Uh, so I greeted introduction greeting repo with the parents and father, child, and
Uh,
examiner. Yes, okay. So I asked the child to walk for me, and it is you are in a stress. Stress means you are in hurry, right? Because time is 6 minutes. So I asked the child that please walk for me, and he walked, and I could not find what is the get, because he was walking almost normal. He was 6 7 years old. So I two times. I just 1 second. Uh, then I asked the child to lie down on the bed couch. So he went to the bed and he was trying to lie down. Meanwhile, thought this might be Wedling gate. So I told the examiner I would like to check his Gower sign. So she said already he is on the bed, so you can check the Gower sign at the end. I said okay, ma'am. Then I started my CNS examination from lower limb. So it was upper motor neuron. So exaggerated everything. Tone was good, more. Everything was good, means higher side. In upper limb, it was almost normal. Then I checked his face, cranial nerves, so like this. So I had sufficient time in that. Later on, I realized. So I was checking over the cranial nerves, his face, eyes, neck, head, everything. And I could not find anything in the upper limb and the face. So, but while he was sleeping, he was sleeping with the cross leg. So then this I was just thinking, what is this? What is this? Because when you are doing the examination, back of your mind is what is the diagnosis? What is the right? You are searching for the diagnosis. So I could see his cross leg. Oh, then I said, to myself, oh, this is diplegic CP, because upper limb is almost normal, no cranial nerve involved. Mentally, he is sound. So then immediately I was very happy. Then I told to the examiner, I just offered that I will do the sensory examination. He said, yes, you can do. She gave me the cotton wool also, and so superficial sensation, deep sensation. I did everything. Uh, in the lower limb. In upper limb, just did the power. Right. So she at the end she said, "You would like to check his Gover's sign?" I said, I just smiled very loud. Means I was smiling and said, "No, no, ma'am, I won't do Gover's sign." Then she was happy. Then she said, told me that summarize. I summarized. Then she asked me the questions. So I answered all the questions. Why she said, "What is the most common cause of diplegic CP?" I said, "This is PVL, prematurity." And she said his upper limbs are normal. I said no, lower limbs are more than the upper limbs. So she was very happy in diplegic CP. So then I was out. I got 8 out of 8, and only one comment I received in all the 10 stations in my marks. That was, she wrote that you were thorough and excellent. This was the comment by her, and she gave full marks. So that was the diplegic CPCNS. So 4 clinical stations over. Now I went to next station. That was my development. And after 5 stations, you get exhausted in the exam. But still, I was trying to. But yeah, I was not so much exhausted that day because everything was going smooth. So in development, there was no role this no patient, only role player was sitting. So I took the history and then presented to the examiner, and then examiner was behaving as a child. So he said this is delayed walking. Child was almost 2.5 years. So I was thinking this because there is no child in the exam. So he was giving me the clues, but I was not able to find out what is the exact diagnosis. So I was thinking this may be Duchenne muscular dystrophy, delayed walking, and then I gave other differential diagnosis, but I was not finding the diplegic CP because that was the case of diplegic CP. Because just now I have finished diplegic CP. How will I get diplegic CP again? So I was wondering. So then told me, the examiner told me, this child, I said, gross motor need to check. So I said he is walking, standing, and running, and everything I asked. So he said he is standing, cruising with the on the table with the cross leg. As soon as he's told me, he was giving me the hint. So 90% examiners will give you the hint if you are not finding the diagnosis. So I said, oh, this is diabetes. I said, this is diplegic CP. So what I mean to say that if you give a real patient in the exam, then by looking at the child in within 2 minutes, we will understand. This is diplegic CP, right? No, you don't have patient and he is just saying just like a quiz contest. He is giving the hint and then you have to find out which CP is this. So this is the negative part of the exam. If they should give either video or the photos of the child, and then they should take this station, because in the real life you are not going to ask the parents take history and then you will diagnose the child without seeing the child, right? Suppose the child is at home and parents have come to you in NHS and giving the history, and you are just asking them milestones and then you have to diagnose. So what is this? Without seeing child you cannot diagnose the case in real clinical life. Then why this is done in the exam? I don't know, because this is a clinical exam, not a theoretical exam, or this is not a quiz contest. But this you have to accept. Right, but I don't know whether they have started with video giving the video of the patient or not nowadays. So he gave me 10 out of 12, though I was very good in development. I knew everything about the development. Even I can say that I know much more than that examiner. But still he gave me 2 marks deducted because I could not tell the diagnosis in first hand. But I am sure that if I see the patient, I will tell him directly. No need of any differential diagnosis, right? Straightforward. Even not only me, anyone can tell that this is diplegic CP. So he asked me about diplegic CP and all. I answered him. So this was my development. After that, I entered in history station. So history chief examiner was there, who is the main examiner of our Royal College. I don't remember her name. She has published a book also, right? DCH clinical exam book is there. What is her name? Do you remember, lady? Uh, one book is there, right? For DCH clinical exam. She is the writer of that book. One is Venugopal. Dr. Venugopal, and another is that Smith or something. Huh? No, no, not Nina Modi. She is from not from India. Smith or some. She's a dark colored lady. She's the chief examiner of. I just forgot her name, but there is a very famous book for this DCH Clinical, and she is the writer. Anyway, she was there, and one more lady examiner was there from Kolkata. So that was the case of fever with rash, and the differential diagnosis was COVID, post-COVID. This what we call SIRS, inflammatory syndrome, right? What is that name? Uh, SARS, or what we call SARS or SIR. Post-COVID inflammatory, in which CRP is very high, rashes are there, just like the D Kawasaki, and then one of that. So I gave the diagnosis, differential diagnosis of all this, that this is post-inflammatory syndrome, PIMS. I gave first is PIMS, second is yes PIMS. Thank you, Dr. Kumar. So PIMS, and then as a Kawasaki, it can be fever with rash, uh, and all that. So it was good. I finished my taking history 1 minute before the time, so that told me that you can ask few more questions. So I just was just searching the question, and I two, three more questions I asked the role player. Then they asked me everything about the PIMS. So how will you invest clinical features, investigations, management, and everything. So I answered, and then yeah, I got full marks in that history station, and I think they were very kind. If there is any uh, different examiner, he may give one or two. What is PIMS? Yeah, post-inflammatory. What is the full form, Dr. Kumar? Post-inflammatory syndrome, multi-system inflammatory.
Oh, multi-system syndrome, post-inflammatory multi-system syndrome.
Yes, post-inflammatory multi-system. Okay, thank you. So they gave me full marks again. The examiners, only two examiners, they deducted my 3 marks were that CVS, which I reserved full marks. So he deducted 1 mark, saying that I'm hesitant, and in development he deducted 2 marks because I did not have the real patient. If I have the real patient, then we can get the full marks. So after history, I went to the communication. First communication was, I think, cystic fibrosis. So it was that the child has been diagnosed as cystic fibrosis, and consultant met the parents in the morning, and now in the evening they want to meet you. So rest of the information you need to give. So it was cool, very good. You have to be confident, and the examiner was very good. So just information giving. So I gave all the information to the mother. Mother was a nurse, I think. So I use jargons, small jargons you can use if mother is a nurse. So they wanted to see, if you don't use the jargons, then you will be downgraded. So small means not very difficult or terminology, but simple medical terminology you can use. So I told her, I'm sorry that your, so whatever name was there, so is diagnosed for the cystic fibrosis, and if this may be difficult time for you people. I can understand that. And then cystic fibrosis, everything explained what was required. And then regarding treatment, I said there is very good treatment available. We need to give supplements like vitamin supplements and antibiotic prophylaxis, preventive medicines. She was nurse, so I said antibiotic prophylaxis. And good thing is that if you follow the treatment, you follow the follow-up is you come for the follow-ups, he will have a quite good life. And now that gene therapy is available, but that is for the about 12 years. So let's hope for the best. Very soon we may get a treatment for such age, otherwise good treatment like this, blah blah. So that was it, and this is how I finished this, and I got full marks in that communication station. I entered to the next station. That was my yes, sepsis, neonatal sepsis. I think early neonatal sepsis. So, and just convince the father for the antibiotic, to start antibiotics for that baby. So that baby, I told him that we need to start, and he has been diagnosed for blood culture is positive. And when we did one test, it's called blood culture, and this is one bug is that the blood culture is positive for one bug, and if the baby is very small, we need to start antibiotic treatment for him. He said, doctor, no, 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 I don't want to start. So then I said, could you please tell me what may be the reason behind this? You have to ask, don't put your own agenda. He said, doctor, no side effects of antibiotics. I said, here benefits are much more than the side effects, and we usually use the medicine which is having least side effects in such small babies. He said, no, doctor, one of my friends' baby was admitted in an ICU, and he was not given antibiotic treatment. Then he got okay, though his baby had fever. So I said, oh, I'm sorry for your friend's son, and I hope he must be doing good now. But in your case, it is very, very important to give, and we need to start very fast, I mean, very early, without delay. He said, doctor, no, I will discuss with my family, blah, blah, something. He said, I said, if we delay the treatment, we sometimes such babies, don't say this baby, sometimes such babies might require breathing machine support, and condition may worsen. Some other vital organs may not be may not function or work later. So this is the you have to we need to decide it fast. He said, no, doctor, no, I don't want to give. So then I said, what should I do? I tried my best. I said, okay, no issues. I can arrange a meeting with my consultant. Is that okay to you? So he said, okay, doctor. Then time up. So in both the stations, I could not summarize because he was asking question, question, question. So time was up, and then I got full marks in this station as well. So both the station full marks without summarizing. I could not summarize in both the stations, but at the end of the exam, when they ask you the feedback, that time I told the chief examiner that I could not summarize in both the cases because the role player was asking question, question. He said, okay, don't worry, we will see you. Hmm. Then I went for the now 8 stations over. Now was the video stations. So first video, very senior examiner was there. Uh, so it was Bell's palsy. So I had seen the video 3 minutes. So I could finish in 1 minute only. Then I told the examiner I'm done. He said you can watch again. So I was watching the video again as his request and making my notes in last 1 minute. Out of 3 minutes, I made some notes on the paper that what he will ask and I will answer. Then I started so he asked me everything about Bell's palsy, and out of 9 minutes, I finished my station at around 7.5 minutes, and I was free. So he was also sitting idle. I was also sitting idle. So we were gossiping for 1 minute. Gossiping means not gossiping, but just casual talk for a few seconds, and then it was station over. I went out. I got full marks in that Bell's palsy. The next one, last station, I was praying to God, oh my God, please, last station should be okay, and then over my journey is over. So next station was uh, atopic dermatitis with secondary bacterial infection, stay aureus. So uh, I had seen the video, but it was very clear to me that it is atopic dermatitis with newborn baby again, and with staph aureus infection. So I started same thing. What are the clinical signs? What is your differential diagnosis? How will you manage and how will you what do you? So in such cases, don't say blood culture. I will do, right. So don't say sorry. Don't say skin swab. Here you can do if it is a passive infection. Blood culture is important, not skin swab. Hmm. So because this was 4S, Staphylococcal scarlet skin syndrome. So I gave my differential. Then I said, actually, according to the examiner, it was 4S. And my first diagnosis was AD with staph aureus. So I said this. Then third, I put 4S. Then he wanted me to say 4S. Then third, I said this is 4S. So he said, okay, very good. So then he asked me about 4S, whatever questions I answered. And then again, I finished my station 1 minute before the time, and we were sitting idle, and then I was out. Whenever you are sitting idle means it means you will get full marks. This is my means I have observed. So be happy that examiner is sitting idle, because if you are wrong, then he will ask you more. He will give you hint and all. So this is how I finished my that station, last station, and I came and I was very happy. And I thought that definitely we will pass, but I was expecting that I will get around 70 marks out of 82. And when I saw my result, it was 79. So I was so amazed. I looked at the screen 3 times. Is it real, my result, or someone else result? But that was 79. So, and journey was over. That is more important, not marks. Because if you get 62, that is also okay. Nobody is going to ask you in the future how many marks you got or not. So this is how I finished all the 10 stations. Uh, yes. So anybody, so what I want to say you that practice is very important. Practice in a good group, 3 4 people. You should have 3 friends minimum, including you, four total 4 people. Sometimes someone is absent or he is busy, then you can practice with others. But a mentor is required. Mentor is must, because if you are 4 people and everybody is saying I am right, I am right, I am right, so then you should have a mentor who can tell who is the right, what is the right, and take at least 2 mocks before the exams, not before exam, much before exam, like 1 and 2 months before, so that last 3 months you will work very hard. And there is no shortcut for any success, so you must work hard, minimum 6 months, maximum 1 year. You need. Hmm. My case was actually I was not exposed to tertiary care too much. I have worked in secondary care, primary and secondary care. So it was little difficult, but still I could manage. Yes, any question you have? Anyone? If you have any question from exam point of view, you can ask me. Mhm. Okay, so if you don't, you can ask me in the group also if you don't have right now. So I'm conducting my courses also last 6 months. So I have completed 4 batches, one full course batch and four like communication history videos and all. So one of my candidate, only one candidate could not pass. I have almost till now 35 candidates have joined me, and maybe 50% have appeared and 50% will appear this month. So one candidate could not pass, and that is she didn't join my development course. She joined only history and video, and she was could not get through because of development only. So that was the thing. Yes, no question from anyone.
Yes, Dr. Pankaj, in the oculogyric crisis,
Yes,
recently communication came. So
yes.
in this, if any patient have oculogyric crisis, suppose after metoclopramide, so
Hmm.
they have a chance to happening in again. So we should avoid giving them in future. Am I right?
Yes, you're right. So what happens? Such unusual scenarios they give very rarely in the exam. And after giving this scenario, they realize that we should not give such scenarios on very unusual scenarios. If you get
Mm.
such very unusual scenarios in the exam, don't worry, because everybody is same in the same boat. If you are not able to perform, then others will not be able to perform, right? So that's
Okay.
one
Okay.
thing. Second thing, I don't think they will repeat this scenario in future. I don't think, but anything can happen. So ocular
Mm.
extrapyramidal side effects of metoclopramide, right? So it is
Mm.
it you should you everyone knows that metoclopramide, but oculographic crisis is the sign of extrapyramidal side effects that very few people knows, right? So
Mm.
this is only 3 things you need to remember: metoclopramide, then extrapyramidal side effects, oculographic crisis. Especially it happens when you give in high dose or in the IV. If you give IV, it can happen,
Mm.
very common. Hmm.
Mm.
And that's all. Otherwise, that's you need to know. Hmm. Okay,
Okay.
but don't bother about that. Very rare scenarios are not such
No,
problem.
but same thing happening na. Now there's another scenario. I think maybe UK exam came.
Which one?
The this one this allopurinol instead of allopurinol, the haloperidol given, and child become drowsy and shifted to PICU. Talk to the parents. So haloperidol also causing this extra pyramidal sign. So this is also one of the scenario,
Yes,
na, like same.
yes, you're right. Hello, Predator and Hello Predator is they have asked many times in the past. Okay.
Yeah, but this time, no, this time they give a scenario that harm happened to child, This not like single dose, nothing happened, your
Mm.
baby is okay. But this time they write that child become drowsy and shifted to PICU.
Okay.
Okay, so then it means the harm reached to the. So then here we talk about maybe some drugs for antidote or something to give into
Mm.
a child.
Okay. So what we learn from this thing, that whatever previous scenarios are there, you need, for example, Hello Brother or Hello Bruno, they have asked in different way. So you should have
Hmm.
complete knowledge about that subject. This is the
Subject, topic, yeah, yeah,
subject
it
topic.
should
So
be.
you not only that they will ask Hello Bruno all time, same thing, same thing. So hello and hello, you have to you should know in details, right? So that is
Yeah,
one
this
thing.
this came in the October 15, same the scenario.
Okay, 15,
Okay. Yeah.
2015, right?
Yeah.
Yes.
No, no, no. Now 22. Yeah,
Okay, 20,
2022 and
22.
15 of October. Yeah. In
Okay.
the UK exam. Yeah.
Yeah, yeah. What I have observed in UK, they ask little difficult topics, right?
Hmm.
But you see in Asian countries, they usually ask very very routine cases, simple and routine cases, right?
No, this oculogaric crisis came
Yeah, that is
in the
one.
Pakistan this September.
Okay. So this can happen anytime, but usually if you're lucky enough, then definitely you will get the. So in my exam, I got all the routine cases, right?
Yeah,
So that is
all the
that,
routine.
that is
Yeah.
your day, right? If God has made your day, then you will get the same cases which you are expecting, right?
Yeah.
Yes. Yes. Any other question? In history, if someone was writing history and development, I'm planning to start history because many candidates have messaged me that they are interested in history course and development. So I will plan history and development this month. Okay, instead of communication, we will start because I think communication many people are teaching. So history and development, I think many candidates are not much confident. So let I will plan to start history and development course in next 10 days or so. So you can message me. Uh, yes, and one more in history station, someone was asking me yesterday. So you should have the thorough knowledge about the subject, and you should know the way of communication. With communication, means how to take history. So these two things, if you know, then you will get full marks. So how to take history and thorough knowledge. If it is a diabetes case, you should know everything about that. If it is epilepsy case, you should know each and everything about that epilepsy. Okay. So in that case, you will, and there are 20 or 30 cases only, like you should say IBD, celiac disease, and diabetes, epilepsy, and like autoimmune hepatitis. So these are very common, and then the fever with rash is very close to their heart. So that one. So these 25, I think 25 or 30 cases, you should read in means depth. So if you read them in depth, that will be useful for your communication also, video station also, not only for the history station. So that is my say on this. And development, what I observed in development, most of the time examiners are very, what we can say, not so cooperative. What I have heard from everyone. So development, you have to be ready. Please arrange history taking sessions. Okay. Uh, So what I observed, this development, I don't know why examiners, very few people get full marks because of, not because of the candidate, because of the examiner. That's what I feel. This is my personal opinion. Mm. So be ready for the developmental station also. Okay. Any other question? Okay, thank you. So I'm sorry that Dr. Ahmad could not join. I don't know what happened to him. He yesterday night he said yes, then only I arranged this meeting. But anyway, no problem. I have shared my experience. And if you have any other questions, should be done. What? Sorry, 1 second, Dr. Ma. How many communication scenarios should be done? Yes, they have almost 100 scenarios in their repository. So I did not understand what you want to say, Dr. Ma. How many communication scenarios should be done before exam? All scenarios should do practice 100 scenarios. In communication, you should have all the leaflets with you. If 100 scenarios are there, 100 leaflets should be there in your laptop. and you should read them at least 2 times and just underline them. So whatever leaflets are there, and because of they will ask you from the leaflets only question answer. Okay, more than 100, yes, yes, 100, more than 100 scenarios there. It's just like video stations, 180 video stations are there with our Royal College. So you should prepare 80 videos. And remember one more important point. If you prepare 90 and you did not prepare 10, and if you get the another one scenario from those 10, then you may not get 100% marks, because you are not confident, you are not familiar with the scenario, so that can deduct your marks. And one more, if you got like 6 out of 8 in 2 3 stations, and one station you got 0 or 1 mark, then it will badly affect your result. So you have to perform good in almost all stations. You should be ready for everything. Yes, my course includes almost 100 scenarios, but those are very old scenarios and not useful. I don't include them, but yeah, almost 80 scenarios, 80 to 90 I include, which are important. Only 10 15 which are very old. They were never asked in last 5 7 years, and they are very easy. Easy means not required for at this stage. That's what. Mm. Okay, friends. Any other question? So I have few YouTube videos which I had done earlier. So you can watch my YouTube videos. Uh, yes, yes, I will do that, Dr. Maha. What I decided now, because full course is very lengthy and very tired, means I get tired. So now I will do history, like then development, then videos. So those who are interested in individual uh, these domains, they can join. So more I will start with the history and development, then we'll go for others as per demand. Yes, 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 got it. Okay, friends. Yeah, it is not necessary that you have joined my course and I will not help you. Yes, you can put my name, Dr. Pankaj Bora, in YouTube, and you will get all the videos. Maybe 10 15 videos right now. Earlier I had 250 videos in YouTube. Full course was there. So once I started paid courses, so I removed, and those were not so good quality because that was my learning days when I was preparing and I used to practice with my friends. But now, if you see my now these videos which I teach to my students, that is 10 times much better than those my YouTube videos, right? So yes, one second, what doctor is saying. Doctor, let's go communicate. Yeah, yeah. Leaflets, leaflet communication means you put in the Google, for example, cystic fibrosis leaflets UK. You put in Google, you will get the leaflet PDF 2 3 pages that you need to download, right? So that is the thing. Yes, Dr. Ma, I can understand, but these are not so good videos. I mean, this is learning. I was learning those days. So that's why I removed, because people will have wrong impression about me. So that's why uh, that is the thing. And Dr. Ahmad, I think I don't know what is the reason, but he is one of my I mean he's one of the favorite teacher. Though all students, Dr. Susan John is also there. She has joined my full course. Dr. Susan, can you open up the mic and give me 2 lines? Can you tell the 2 lines about my course? See, Dr. Susan joined my full course, and now we will finish that course in next week. She also joined, and communication I will finish in next 7 days. Dr. Susan,
Hello.
yes,
Uh, yeah, I was listening your experience in the exam. Actually, what I have to tell about Dr. Pankaj is that his notes, his recordings are very fantastic. His class, he's a great mentor and great teacher. He's very good. I really enjoying his classes and recordings. It is fantastic.
and before me, you joined other courses also, I think 1 or 2, right?
Yeah.
So how you found my courses compared to other courses?
Yeah, it is very good. It's really good because the way you teach us, like you are teaching us like small children.
Okay, thank you.
Thank you.
Yes, thank you, Dr. Susan. So
Thank
she
you.
joined me full course, but now I usually don't prefer to start full course because this is very too much. It's hard work we have to do, right? So I will start individual courses like history, development. So whatever course you want to join, Tom, and you can join. Okay, thank you, friends. Sometimes, some other time, I will ask Dr. Ahmad if he is free, then we can take the feedback regarding Pakistan, his Pakistan journey. He was passed 2 days back. Okay, I will post this video recording on the YouTube. So anybody who is interested, you can watch my feedback. Okay, thank you. Bye. Thank you.